Mrs. Brown. My name's Kelly. I'll be your nurse today. So, tell me your name and how old are you?
My name is Helen Brown and I'm 75 years old.
Okay, so tell me a little bit about yourself.
I recently moved to a retirement community to be closer to my daughter after my husband Henry passed away. He was such a sweet man.
Okay, so I saw that you went to the emergency department for a fall here recently. Can you tell me a little bit more about that?
Yes.
Okay.
I still have so much pain in my hip from the fall, and I've noticed more indigestion than usual, and these headaches are so worrisome.
Okay.
And little things just irritate me lately.
Okay, so let me see if I get this straight. You went to the emergency department recently for a fall. You've been having some headaches, hip pain, indigestion, and irritability here lately. Is that correct?
Yes.
Okay. Is there anything that may have precipitated the fall, caused it?
The amount of cocktails that I've been consuming daily.
Okay, so you've been drinking a little bit.
Yes.
Okay. How many cocktails would you say you drink?
Around 2 a day,
Okay.
but it can vary. It depends.
Okay. All right. So the hip pain, on a 0 to 10 scale, 0 being no pain, 10 being the worst, what would you rate it?
Around a 5.
Okay. How have you been sleeping?
When I don't drink my cocktails, I have a hard time sleeping, but when I do, I can pass out.
Okay. Have you noticed that you've been spending more on your cocktails?
Yes.
Okay. So have you been taking anything over the counter for your sleep or your pain?
Yes.
Okay. And you take medications for your hypertension and your diabetes as well, correct?
Yes.
Okay. So, have you ever smoked cigarettes, cigars, any other tobacco products?
I don't smoke, but I have tried once and it just wasn't for me.
Okay. So as far as the alcohol consumption, it sounds like it is a problem. We did an assessment on you and it kind of gauges your consumption and your behaviors as far as alcohol, and what you scored for your age, you are drinking way more than the suggested amount. For someone your age, it should be 1 cocktail a day or 7 a week, and you're doubling that. So we need to discuss ways to possibly cut back and maybe even eventually be able to cut it out, okay? So alcohol can tend to turn into sugar, and with you being a diabetic, that could raise your blood sugars. Also, with your indigestion, the alcohol can tend to back up and irritate the esophagus and cause something called esophagitis. So that might be why you're having that increased indigestion. And it can also affect your blood pressure. There's something called alcohol-induced hypotension, which could lower your blood pressure. So we really need to discuss ways to try to cut back on your alcohol, okay? What do you think about all this information so far?
Interesting.
Okay. So tell me more about what you enjoy about drinking.
It helps me cope with Henry being gone. I started drinking a little bit more, but I just can't seem to stop. If you ever lost a husband who is your best friend, it's one of the hardest things to go through.
Okay. So let me see if I understand. What you're telling me here is that drinking helps you to cope with the loss of Henry, and you started drinking a little bit more, but you just can't seem to stop doing that. Okay. What are the good things about drinking?
I always fix a cocktail when I start feeling sad. It's all I have. My drinks are what get me through the day sometimes. And when I stress, the drinks help take the worry and sadness away.
Okay, so when you drink, the drinks help take away the worry and the sadness.
Yes.
Okay. What are the not so good things about drinking?
Drinking isn't good, period. I wish I had never started this habit, but now now I just find it to be a part of my routine.
Okay, so you don't think that drinking is a good habit, but you have fallen into the routine, and now it's just become part of your daily routine.
Yes.
Okay. All right, so what connection do you see between your drinking and stress and tiredness lately?
Because I'm too old to keep doing this to myself, and my health isn't getting any better. I've always fixed me a cocktail when I start feeling sad. It's all I have. My drinks are what get me through the day sometimes.
Okay, so your cocktails are what help you get through the day sometimes, and do you fix those when you start feeling sad?
Yes.
Okay, so I know that some of this information can be difficult to talk about. These questions have been very personal, and I can tell you're a little uncomfortable. So your answers to the screening questions suggest that you may be at risk for problems related to your drinking, and I'm really concerned about this. So drinking can impair your judgment, and it can impair your coordination. You already know this from your recent fall. It can also affect your health, which now you're starting to see with the indigestion and the headaches and the irritability. So I'm going to give you some handouts. I want you to try Alcoholics Anonymous. It's a group where recovering alcoholics and recovered alcoholics go to discuss their journey, and eventually you'll get a sponsor and they'll help you through your recovery, okay? And also maybe some other group therapies, such as a group therapy for coping with the loss of a loved one, okay? It sounds like you might need some support with that. You're having some complicated grieving, okay? So let me see if I understand so far. It sounds like your drinking has been increasing over the past few months since your Henry has passed away, and you think this, we know that this is related to your grieving, but you're just not certain that you are fully ready to quit or able to quit. Sounds like you just need some support. Does that sound about right?
Yes.
Okay. So how ready do you say you are to quit smoking? Like, do you feel like you're ready? How ready?
Around a 7.
Okay, on a scale of 1 to 10, how ready are you to change?
A 7 as well.
Okay, so why would you place yourself at a 7 and not a 1 or a 2? One or 2 is not ready for change. Why would you say you're a 7, that you're ready? You're pretty...
Because I'm too old to keep doing this to myself, and my health isn't getting any better. I have grandbabies as well, and if I'm drinking, then how can I possibly care for them?
Okay. So how confident do you feel that you'll be able to reduce your drinking, and place this on a scale of 1 to 10 on how confident you feel about stopping?
A 7.
Okay. So what would have to happen for you to feel more confident about making this change?
Support and distractions.
Okay. So a 7 is great on the readiness scale. It says you're 70% ready to make this change. You handled yourself really well today, and you're definitely capable of making these changes, and you're fully motivated. I feel it. It's just we need to find some support and get through the grieving, okay? I would suggest reducing your drinking before going to bed, and then we'll discuss with the doctor about maybe getting you on something that will help you sleep at night, okay? I think it would be worth considering ways to manage your stress, maybe doing some walking exercises, walk around the community that you live out now, maybe meeting some people, and card games, bingo night, and just make sure that no alcohol is involved with these activities. Maybe going for swimming, going on family outings with your daughter and the grandkids would be great. Anything that's going to be distracting and that's going to take the place of the alcoholic drinks. So, have you thought about trying to deep breathe, yoga, any other exercises like that?
No.
Okay. Well, deep breathing involves breathing slowly through your nose and exhaling through your mouth. Try it one time for me. Good. Do that a few times, especially when you find yourself really stressed. And I think that you will find that it will help, okay? Let's try to come up with a goal for cutting back on your drinking, okay? And what steps do you feel you can take to help you cut back?
Maybe finding a different drink in place of it, a non-alcoholic drink.
Okay.
Like a juice, cranberry juice.
Okay, that sounds like a good plan. And what are some things that you can do after later to help you to relax instead of drinking?
Swimming. I like swimming or dancing.
Okay.
And listening to calming music or my favorite music.
Sounds wonderful. And what kind of support systems do you have?
My family, my daughter, and my granddaughter, and my grandchildren.
Okay. Well, so I would like to see you next month to talk about how you're doing with cutting back, and at our next visit we can talk about more alternative strategies to help deal with stress. I'm going to give you some information to help you with treatment programs as well that may help, okay?
Okay.
All right, Miss Helen, it was nice meeting you.
Nice meeting
Can't
you
wait
too.
to see you in a month.
Mm-hmm.